Critics of government have blamed it on rampant poverty and blamed it on government. FDC leader Dr. Kizza Besigye, during the last presidential campaigns, referred to Busoga sub-region as the headquarters of poverty in Uganda, while his UPC counterpart Dr. Olara Otunu said Jiggers would be Museveni's legacy in Busoga. It is an outbreak of tangiasis, tropical parasitic skin disease commonly known as Jiggers, that has killed at least 20 Ugandans and taken host in more than 20,000 people in just 2 years. Jiggers is caused by a female sand flea, Tanga penetrans, which burrows into the skin of its host, usually on the feet, but occasionally on the lips, buttocks, and even eyelids, and undergoes hypertrophy within a day or two, eventually expanding to the size of a pea. The flea's hindquarters remain in contact with the air, providing an avenue for breathing, defecating and expelling eggs, while creating a painful lesion on the host's skin, which often serves as an entry point for pathogenic microorganisms. Over the course of about 3 weeks, the flea will expel as many as 200 eggs into the environment and then die in stew, leaving a black crust covering a lesion containing the dead flea, which is eventually sloughed off from the epidermis. If untreated, patients can die of secondary infections such as tetanus and gangrene, according to the American Center for Disease Control and Prevention. Jiggers can easily kill young children by sucking their blood and even cause early death in grown-ups who have other diseases. Most of those infected, especially the elderly and children, cannot walk. The first reported case in Uganda was the death of a 3-month baby in Bujiri district on October 6, 2010. Government then instituted a task force comprising 4 ministers to oversee the extermination of the parasites from the region. Rebecca Kadaga, then the Deputy Speaker of Parliament, who also hails from Busoga, launched a campaign to treat over 600 people in Busoga plagued by the parasites. At least 80 pupils in Luka, Iganga and Mayuge districts have dropped out of school and 200 homes and 20 schools threatened. There are low levels of awareness about the cause, mode of spread and prevention of Jiggers among Ugandans. In fact, myths surrounding the disease are an obstacle to eradication.
Kisookedde Busoga. Na wano mu Buganda kyaliwo abantu abakulu bakimanyi bulungi. Twafuna ensekere empitirivu abantu b'e Busoga. Envunza zibadde zibaluma nga tibalina kyabazinga.
These Jigger infestations are elsewhere where there's no kyabazinga, but still you find that these Jiggers are there, so it's not perfectly correct.
Treatment largely involves removal of the flea with a sterile needle and topical application of an antibiotic in case of secondary infection. If the flea bursts, for example, during the attempt to extract it with a needle, wire, nail, etc., severe inflammation is inevitable. Factors influencing the incidence of the disease include stray dogs and cats, pigs in close vicinity to living quarters, unpaved streets, mud floors in houses, insufficient or non-existent sanitation, and infestation with rats and mice, especially in areas without rubbish disposal. Many people, especially children, mostly walk barefoot, only wear slippers. Illiteracy, ignorance, and neglect, presumably, are other factors favoring the high prevalence of severe pathology in children living in these circumstances. Tangiasis is a disease of the poor. Jiggers are mostly associated with poor hygiene and sanitation, as well as walking barefooted in areas known to be infested with the parasites. In most cases, bathing daily should be sufficient to prevent the infestation. This ectoparasitosis is endemic in economically depressed communities in South American and African countries. For Uganda, Jiggers remain a challenge. Remy Bahati, NBS Television.